Understanding gout, a comprehensive guide. The sudden, searing pain, often described as feeling like a joint is on fire, is the unmistakable hallmark of a gout attack. For centuries, it was known as the disease of kings, associated with rich food and drink, but the reality is more complex. Gout is a common, painful form of inflammatory arthritis that can significantly impact quality of life. Understanding what it is, why it happens, and how to manage it is the first step towards regaining control. Let's break down the essentials of gout, answering the most common questions surrounding this condition. What is gout? At its core, gout is a type of inflammatory arthritis characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, most commonly the joint at the base of the big toe. These attacks are caused by the deposition of needle-like crystals of monosodium urate, a substance derived from uric acid, within the joint and surrounding tissues. What causes gout? Gout is caused by a condition called hyperuricemia, which means having too much uric acid in the body. Uric acid is a natural waste product formed from the breakdown of purines, substances found naturally in the body and in certain foods and beverages. Normally, uric acid dissolves in blood, passes through the kidneys, and is eliminated in urine. However, if the body produces too much uric acid or the kidneys don't excrete enough, uric acid levels can rise. When levels become too high, uric acid can crystallize. These sharp urate crystals then accumulate in joints, triggering the painful inflammatory response of a gout attack. What are the symptoms of gout? A gout attack, often called a flare, typically strikes suddenly and often at night. The most common location is the joint at the base of the big toe, known as podagra, but other joints can be affected, including the ankle, knee, elbow, wrist, and fingers. Symptoms include intense pain. This is usually the most severe symptom, occurring within the first 12 hours. Inflammation and redness. The affected joint becomes swollen, tender, and red. Heat. The joint may feel very warm or hot to the touch. Limited range of motion. It can be difficult to move the affected joint. Even after the most severe pain subsides, some joint discomfort can last for days or weeks. Swelling and redness may persist. How is gout diagnosed? Diagnosing gout involves a combination of factors. A doctor will first evaluate your symptoms and medical history. Physical examination of the affected joint is crucial. The most definitive way to diagnose gout is by drawing fluid from the affected joint, synovial fluid aspiration, and examining it under a microscope for the presence of uric acid crystals. Blood tests can measure uric acid levels, but high levels do not always indicate gout, and levels can actually be normal or even low during an acute attack. Imaging tests like X-rays, ultrasound, or CT scans may sometimes be used to rule out other causes or detect chronic joint damage or urate deposits. Tophi. Is gout curable? While the underlying tendency to produce or excrete too much uric acid isn't typically cured, gout is highly manageable. With appropriate long-term treatment, which often involves lifestyle changes and medication to lower uric acid levels, gout attacks can be prevented, existing crystal deposits can be dissolved, and the risk of complications can be significantly reduced, allowing individuals to live symptom-free lives. So, while not a traditional cure, It is certainly controllable and preventable with the right strategies. What treatments are available for gout? Treatment for gout has two primary goals: treating the acute attack and preventing future attacks and complications. Treating acute attacks, medications are used to quickly reduce pain and inflammation. These include non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen or naproxen, colchicine, which specifically targets gout inflammation, and corticosteroids, taken orally or injected into the joint. Preventing future attacks, long-term management. This involves lowering uric acid levels in the blood to prevent crystal formation and dissolve existing crystals. This is primarily achieved through urate-lowering therapy, ULT, medications like allopurinol or febuxostat, which decrease uric acid production, or probenecid, which helps the kidneys excrete more uric acid. The choice of medication depends on the individual patient and the cause of their hyperuricemia. Can diet affect gout? Absolutely, diet plays a significant role in managing and preventing gout. Since uric acid is formed from purine breakdown, consuming foods high in purines can raise uric acid levels. High purine foods include red meat, organ meats, like liver, and certain seafood, like anchovies, sardines, mussels, scallops. Sugary drinks, especially those with high fructose corn syrup, and alcohol, particularly beer and spirits, are also strongly linked to an increased risk of gout attacks by affecting uric acid metabolism and excretion. A healthy diet focusing on complex carbohydrates, vegetables, fruits, and low-fat dairy can be beneficial. Hydration is also key, as drinking plenty of water helps the kidneys excrete uric acid. Who is at risk for gout? Several factors increase the risk of developing gout. Sex: men are more likely to get gout than women, though women's risk increases after menopause. Age: gout typically occurs in adults, with the risk increasing with age. Genetics: a family history of gout increases susceptibility. Obesity: being overweight or obese raises uric acid levels. Certain medical conditions: untreated high blood pressure, diabetes, metabolic syndrome, heart and kidney diseases are associated with gout. Certain medications: diuretics, water pills, low-dose aspirin, some medications used to treat high blood pressure, and anti-rejection drugs used after transplant can raise uric acid levels. Diet and lifestyle: a diet high in purine-rich foods, fructose-sweetened beverages, and alcohol consumption are significant risk factors. What are the complications of untreated gout? Leaving gout untreated can lead to serious complications. Frequent and severe attacks can cause chronic, disabling joint damage and deformity. Uric acid crystals can accumulate under the skin in lumps called tophi, which can occur in joints, cartilage, bones, and other tissues. Tophi can be disfiguring and damage joints. Chronic untreated gout also increases the risk of developing kidney stones and can contribute to chronic kidney disease. There is also an association between gout and increased risk of cardiovascular conditions, though the exact relationship is still being researched. Can gout be prevented? Yes, gout is largely preventable, particularly with long-term management. For individuals with hyperuricemia but no prior attacks, lifestyle modifications like maintaining a healthy weight, following a gout-friendly diet, Minimizing alcohol and sugary drinks and staying hydrated may be sufficient. For those who have experienced gout attacks, preventing future flares primarily relies on achieving and maintaining target uric acid levels, usually through urate-lowering therapy, ULT medication prescribed by a doctor. Adherence to medication and lifestyle changes is key to prevention. How long does a gout attack last? Without treatment, a gout attack typically lasts anywhere from a few days to 2 weeks. The most intense pain is usually within the first 12-24 hours. Even after the peak pain subsides, milder symptoms like discomfort, swelling, and limited movement may linger for a week or 2. With prompt treatment using anti-inflammatory medications or colchicine, the duration and severity of an attack can often be significantly shortened. Can gout affect more than one joint at a time? While the classic presentation of gout involves a single joint, particularly the big toe, it is absolutely possible for gout to affect more than one joint simultaneously. This is known as polyarticular gout. Polyarticular attacks tend to be more common in people with long-standing or more severe gout, often those whose condition has been untreated or inadequately managed. However, the initial attack is most frequently limited to one joint. Does gout go away on its own? An individual gout attack will eventually subside on its own, though it may take days or weeks and leave lingering discomfort. However, the underlying cause, hyperuricemia and the presence of uric acid crystals in the body, does not go away on its own. Without treatment to lower uric acid levels, crystals will remain and continue to accumulate, leading to future, potentially more frequent and severe attacks, and increasing the risk of chronic complications like joint damage and tophi. Therefore, while a flare resolves, the condition itself does not. Are there support groups for people with gout? Yes, living with a chronic condition like gout can be challenging, and support is available. Patient advocacy organizations focused on arthritis and rheumatic diseases often provide resources, educational materials, and connections to support groups or online forums. Sharing experiences, tips for managing flares, and navigating treatment with others who understand can be very helpful. Your healthcare provider may also be aware of local resources or national organizations that offer support. What research is being done on gout? Research into gout is ongoing. Areas of investigation include developing new urate-lowering therapies. Scientists are working on new medications for patients who don't respond well to current treatments or experience side effects. Improving understanding of the inflammatory process. Research aims to better understand how uric acid crystals trigger inflammation to develop more targeted anti-inflammatory treatments. Genetic and metabolic studies. Investigating the genetic factors and metabolic pathways involved in uric acid production and excretion to identify individuals at higher risk and develop personalized treatment strategies. Epidemiological studies, monitoring the prevalence of gout and its associated risk factors and complications in different populations. In conclusion, gout is a painful but highly treatable and preventable condition. Understanding its causes, recognizing its symptoms, seeking timely diagnosis, and committing to long-term management through medication and lifestyle adjustments are crucial steps in controlling gout and preventing its potentially debilitating complications. With proper care, individuals with gout can significantly reduce or even eliminate attacks and maintain an excellent quality of life.